Coordinator. And today we have special guests from the Executive Office of Elders Affairs. So let me introduce to you first Karyn Wylie, and then Rachel Weiner and Alexandria Theobald-Colbert. Ladies, let's start with Karyn, then Rachel and Alex. Would you mind letting us know who you are and what you do? Karyn.
Sure. Thank you so much for having us today. So, should we get started with our presentation? Or do you want me to just first talk about a little bit about who we are?
Why don't you, if you could just introduce yourself and share with us what you do, and then after you, Rachel, and then Alex, and then we can go right into your presentation.
Okay, sure. So my name is Karyn Wylie, and I am the Aging Disability Resource Consortium Coordinator, long title, ADRC Coordinator at the Executive Office of Elder Affairs, and I am also the Community Care Ombudsman as well.
Rachel?
Yeah, okay. Hi, I'm Rachel Weiner, and I am the director of the Options Counseling Program at the same agency as Karyn, the Executive Office of Elder Affairs. And you'll be hearing more about that today.
And Alex.
Yes, hi everyone. My name is Alexandria. I work for South Shore Elder Services, and I am the Community Enhancement Specialist. We're located in Braintree, and we're here to meet all your needs.
Wonderful. All right, so Karyn, I know you, Rachel, and Alex all have a wonderful presentation ready for us so we can learn more about the services that's available for the aging population. Would you mind getting us started with that presentation?
Sure. Okay, can everybody see this?
Yes, yep.
Okay. So I'm going to first start talking about what is an ADRC, as you may probably be thinking about. An ADRC is Aging and Disability Resource Consortia. Massachusetts was one of the first 12 states in the US back in 2003 to start an ADRC. So Massachusetts, what they did is they built off the infrastructure that we already had of two key agency networks with aging service access points and also area agencies on aging. Sometimes they are the same agencies, but sometimes they could be separate. And also independent living centers, which we're going to talk a little bit more about. So for aging service access points across the state of Massachusetts currently right now, there's, I believe, around 25 of them. For independent living centers, we have 11 of them. And then it's all their community partners. And for triple A's, I believe it's less. I don't know how many we have for triple A's right now. I think it's like around 23. And with ADRC, we have a motto that it's a no wrong doors system. So what happens is when an individual calls in, it doesn't matter whichever agency you call, you get to the correct agency that you're looking for. So the nice part is you don't have to call and say your story 100 different times. You only call and you say your story once. And then you just wait for the correct agency to give you a call. And all the different agencies work together. So it helps widen the front door for services for anybody to enter. So it's great. What is the role of an ADRC? The role of an ADRC is to increase awareness and provide reliable information of long-term services and supports. It helps individuals and communities become aware of information. Individuals have the relevant information to make decisions which are best for them. Individuals have streamlined access to determine what their needs and wants are. And it helps promote and embody principles of consumer-centeredness, self-direction, cultural competency, and accessibility. So there are core functions for this ADRC. So one of the core functions is information and referral, which we're going to talk a little bit more about. And options counseling is another core function of the ADRC. Also, streamlined eligibility, that individuals are eligible for programs and that they'll be aware and they'll have improved access to the services that they're eligible for. Care transitions, that they're person-centered care transitions. And quality assurance, and that there's always continuous improvement. Right now, let's just take one quick little moment. How many ADRCs do you think that there are in Massachusetts?
Oh,
If you guessed 11, you are correct. So here's a nice little colorful map that shows you the 11 ADRCs in Massachusetts, and they're all based around our independent living centers. So the green shows you that's the ADRC of Berkshire County. Then the gray shows you Boston ADRC. Then like the teal green color is Cape Cod and the Islands ADRC. Then we have Central Mass ADRC. We have ADRC of Merrimack Valley, Metro West ADRC, Metro Boston, North Shore Link ADRC, Pioneer Valley ADRC, and then we have Southern and Southeastern ADRCs. So these ADRCs, either you're a part of one or you may work in one. So the ADRCs are great. So this is just another thing. It isn't all inclusive, but it's just telling you a little bit about who makes up part of the ADRC. So as we said, it's agent service access points, which also before were known as elder service agencies like South Shore Elder Services, area agencies on aging, independent living centers, council on agents are part of the ADRC, visiting nurse associations, mass options, which we'll talk a little bit more about. Hospitals are part of the ADRC, private pay agencies, doctors' offices, veterans agencies, schools, local government agencies, fire and police departments, and also different state agencies are part of the ADRC. So this isn't an all-inclusive list, but this is a great another like little visual to show you. It's a broad array showing you of all the different members of the ADRC, the different agencies. Now we're just going to talk a little bit about information and referral. You're probably wondering, what is information and referral? So information is not only giving information out, it's taking information in, and it's also given referrals to the individuals that call. It's usually a centralized point of intake. So when an individual calls one of the agencies, whether it's an agent service access point, an area agency on aging, or an independent living center, it's usually the first point of contact where they call one of these agencies, that they talk to an information and referral specialist first, who would help the individual or the professional with information. They also can help provide advocacy, and are not only aware of the different programs and services that they offer within their own agency, but they're also aware of whatever else is around in the community to let them know what is available. And a lot of times too, information and referrals specialists also ADRCs certified, which is a national certification. ADRC stands for Alliance of Information and Referral Systems. So with information and referral, it can occur a lot of different ways. It's not just on the telephone. A lot of times too, the information and referral specialists, they can get email requests, they can get faxes, they can get text. Before the whole pandemic, they'd also get a lot of individuals that would just walk in saying, hey, I need some help. And they would sit down with the individual and they'd let them know what was out there to help them. They also, which we'll talk a little bit more about, mass options. We have a mass options portal where the information referral specialists will get requests that way. And now with the whole pandemic, some of the agencies do face-to-face over the computer. So they'll do requests that way. With information and referral, as we mentioned, it's a core function of the ADRC. It's an entry point for assessing needs for the individual, and it's a hub of information. So they work with that individual to let them know of the information that's out there, and they decide what program would be best fit to which way to refer them to. And information and referral is not only for an individual that's calling, it's also available for professional use. So a lot of times too, they may get a call from a social worker at a nursing facility, or they may get a call from a discharge planner at a hospital. And maybe they want to know about some service that's out there, or they need a list of some type of resources. If the information referral worker does not have that information, they are willing to research it, look it up, get the information, and then get back to that professional to let them know as well. And now I am going to turn it over to Rachel Weiner.
While Karyn, while Rachel is getting her presentation ready, can I just ask you a couple of questions?
Sure.
All right. So as far as if somebody lived, say, in the Boston area, you showed us this beautiful, colorful map. If they lived in the Boston area and was receiving ADRC services, and then they were to move to the Berkshires, how seamless would that transfer of service be? And would the services be the same in every location in the state?
So that would be a seamless transfer. So if they were already set up with services through an ASAP or an independent living center, they would talk to the company that they're already working with before they move. So they would ahead of time put that referral into the company behind the scenes so they'd know. But what would end up happening is when they do move, they'd have to go out and they'd have to assess where they move to, just to make sure, because once they move, it'd be a different home environment. So they want to just reassess and make sure that all their where they live is the same and all their needs are the same. Because over time, things could change, because even though sometimes it could be the same exact service plan, but what happens if all of a sudden they were driving there and then something happened and they tripped and fell and then they need a little bit more help? You know what I mean? Mm-hmm. Sometimes you need more, sometimes you need less, but that's why it would have to be reassessed.
That makes a lot of sense. So they would have to do a complete home safety eval and many, taking into consideration different types of support system that they might have in the new living situation.
Right. And feel free to speak up, Alex.
Okay.
I know you're a little bit more specialized in that area.
No, Karyn is correct. It's seamless, and it's a really great network that we have. So it makes it easy for folks to, if they want to move and go one place to another, they don't have to do all that legwork on their own.
Oh, that's great. So would it be, is it the ASAP, the Aging Service Access Point person? Would that professional be the same person that's going to continue to follow that person when they move to another location.
It would be a different professional, but with the same kind of a role. So the idea, I mean, you're getting right at the idea of the ADRC, which is to have the agencies work more effectively together behind the scenes so that they can make these kinds of transitions for people without them having to do all the legwork. So they wouldn't have, say, the same case manager if they moved from the South Shore to the Berkshires. They'd have somebody in that region, but there would be the behind the scenes communication so that the individual could receive those services without putting out a lot of, having to do a lot of the legwork themselves.
Mm-hmm. Makes sense. Great. Thank you so much. Thank you.
Okay, should I go ahead, Debbie, then?
Yes, that'd be great.
All right, sure. So Karyn had mentioned that as part of this ADRC initiative, or whatever you want to call it, this networking, which is really an effort for agencies to work more closely together so that we can be more effective in providing information and services. So it's kind of just these regional networks that she referenced. And as part of that, one of the core functions of the ADRC is the Options Counseling Program that I oversee. And and it's administered through these local agencies, through the ASAPs and the Independent Living Centers. So, you know, as I'm presenting the information, you just might want to think about, is this a program that might benefit you or somebody in your family or in your community, or maybe you have somebody across the state that might benefit from it. So it is a free service and it's available to most individuals. And it is for older adults, age 16 above, people with disabilities, caregivers, guardians, and other involved parties. Okay, but it's not so much for the professional. So Karyn had mentioned INRs for the professional. It's more geared towards the needs of individuals. And this is just showing some of the key components of the service. So it provides information, decision support, choice, and help connecting to services. So the idea is really the goal of the program is to ensure that people have the information and support they need to access resources that can support them to live in the way that they'd like to live. And we'll get a little more specific about what that means. This is reiterating that a bit. Options Counseling provides individuals and family members with information, decision support, and help connecting with resources to allow older adults and people with disabilities to live as independently as possible. So there's really a wide variety of people who can benefit from this program. I'm going to share, some kind of quick examples of what that means. Okay, so a person who is at risk of being discharged to or from a hospital or a nursing facility. So that would be, our options counselors have worked in those settings, can visit people in those settings. Not so much right now. The visitation is more limited, so they're relying more on other ways of communicating. But that's certainly a group that we work with. Sometimes people aren't aware of the community options and they end up in a nursing facility because they don't know that there are a lot of great supports out there that can provide them with a level of support that could allow them to be in the community. We also work with people who are in facilities and want to transition to the community. Another example of somebody who's in the community who has a change in their medical condition and needs more assistance. And an example of this might be somebody who has a vision loss, maybe due to a medical condition, and they've been functioning quite well at home, but now they're finding, gee, I don't think it's safe to drive anymore. So how am I going to get my groceries into my appointments? Or maybe They could benefit. There's some safety issues in the home, scatter rug, something they might trip over. So they might have an evaluation for that. Or maybe those little knobs you can put on stoves, so they can see, is this stove, is the burner off or on? Is it high or low? So the options counselor would sort of explore these different resources and programs with the individual to just kind of shore up their support so they could continue to thrive in the community. Somebody who has a newly diagnosed disability, so it might be a younger person. As I said, options counseling is for people across the lifespan, older people, older adults, and younger people with a disability. So if someone had a diagnosis and they really didn't know where to turn for help, an options counselor, either at an independent living center or an aging service access point, is a good resource. So the independent living centers work with people with disabilities across the lifespan. And they might connect somebody with, if the person was diagnosed with a specific condition, say multiple sclerosis, with the MS Society, maybe with Mass Rehab, for some home care services, if the person had that level of need, maybe look at some assistive technology to help them with their mobility and stability. So that is that. Okay, then most times we see for options counseling people who are confronted with a change in their situation or their level of need. And so it's sort of at a crisis point, but sometimes people are a little more forward thinking and they want to know their options in advance. I can kind of testify to that as an older person, thinking about, well, gee, what's going to happen when I do have some needs that maybe I can't meet on my own? What's going to be out there for me as a resident of Massachusetts? One of the things to think about are different housing models. So for people that either own a home or live in an apartment, what are some other possibilities? Could be a supportive housing site. So there's some state-sponsored housing sites that provide some services but have independent apartments. Might be somebody that is looking at a assisted living facility or a continuing care retirement community where you can age in place from independence to needing nursing home. There are congregate living sites, which are a little bit of a different shared living model. So there's really a lot of different possibilities out there as for housing and of course for services and supports. Okay, could be somebody who's has some financial need, for example, and is looking for a little assistance to help with their situation. We have a program called the Senior Medicare, not Senior Medicare, sorry, I'm thinking of something else. The Prescription Advantage program, which is offered through the state, and that offsets some of the costs of prescription drugs. A lot of people don't know about that program, and it can just help with some of those costs. It could be for SNAP, the food assistance program, or fuel assistance. So the options counselor can help to evaluate people for eligibility for those programs, or if they themselves do not do it, because there's a little bit of difference sometimes in the exact service that the options counselor provides. They would connect somebody to an individual who could do that screening for them. Lost their caregiver. So sometimes people have been receiving support from a family member, and maybe that family member is aging or not able to provide that same level of support. So they're going to need to access more formal services, or maybe the individual has increased needs and the caregiver can't meet those needs. So for the first time, they need to explore what's out there, what might be helpful. And then if a caregiver wants to know options available, again, so that's for the forward-thinking caregiver before a sort of emergency or crisis comes up. They want to think about, gee, I see that my mother is going to need some more services soon. She's doing all right now, but what can we expect? What kind of help might she be eligible for? So let's see. So this is just talking about, some of the things to think about. So if somebody has a new need or an increased need, they're going to be thinking through, what should I do? Could I move in with a family member? Should I go into a nursing facility? How about an assisted living facility? Or maybe to remain at home with help, and what would that look like? So the options counselor can kind of walk through the possibilities with the individual and or the family. And how does it work? Essentially, it's a short-term service. So the typical length is 6 to 8 weeks long, but I've seen some options counseling that's a lot shorter than that, and some that's significantly longer. So it's a flexible model, but it's really meant to help the person understand the options, evaluate the options, and then move forward. It provides one-on-one and one-on-family person-centered counseling. So really the counselor's there to support the individual to understand what their needs are, what their goals are, and to work with them to help them move in the direction that they want to go. So we say that the options counselor should be doing more listening and less talking, that they really want to understand this individual and what would be for them, what they want, what they're looking for, and to really tailor the options around that. So I mentioned they are identifying goals, discuss options, next steps, a final counseling session. And then after the process is complete, they want to follow up with the individual just to see, has anything changed? Are you moving forward in the way that you want to, and so on. And then the options counseling can continue if the situation warrants that. It is available, I've already gone over this, for people of older than 60 and older, people with disabilities, family members, caregivers, guardians, and there is no charge. Also, I will add, the person can be of any income, any insurance type, or no insurance. So that's also true. So where does it happen? Okay, it can happen really anywhere. And home has been a common setting for options counseling. Community agencies, COAs, facilities, nursing and rehabs, hospitals. It can be an informal meeting with an individual or a caregiver at a coffee shop or a library. In an assisted living residence, if that person is looking to explore other options. We do have some options counseling that happens in homeless shelters and with people who are living basically on the street at this point. We have some options counseling that occurs in medical offices, particularly in the North Shore. We have options counselors that are actually housed in the office, so the physician or the medical practitioner can make a referral right away to an options counselor if they think it's appropriate. And let's see, do I have more? Let's see. Okay. So methods, as I say, it used to be more of a combination of in-person, phone, and often email. Now we're seeing it more remotely, phone, email, and some virtual computer-based communications as well. And right now I am seeing some options counselors that are doing a lot of phone work or virtual work, and then they will follow up. If they're helping somebody, say, with an application, they may go to pick up the application or have the person do the sign it. So they're doing kind of brief focused visits in person as well. And so the value of the program, one of the values is that there is an awful lot of information you can find yourself out there if you go online, particularly, and start looking around. But it's hard to understand really if you would be eligible, what it would really look like in practical terms. So an options counselor already has a little view of the landscape, and what they don't know, they can research. So there's an awful lot of information, and it changes continually. So the options counselor is a wonderful resource to kind of review and discuss things with. And also just, it's really nice, particularly if you're in a time of crisis or change, to have somebody there that can listen and knows a little bit of what might be helpful in the moment, takes a bit of the burden and stress off of individuals and caregivers to have this person in there involved in this process. And the last thing was, I said it offers practical assistance. So though the core of the options counseling is information, decision support, and help connecting with resources, they do sometimes help with things like mass health applications or a housing application, or review that application to make sure it's, all the information is there. So that's where there's a bit of flexibility involved in how much hands-on assistance they're going to provide. But if they don't directly do that, they're going to direct the person or connect the person to somebody who can. So I am now, I think, I'm going to turn it over to Alex from South Shore Elder Services. And as part of her role, she oversees the Options Counseling Program. And she's going to share some examples that will help to, to get even a better picture of how the service works. So I turn it over to you, Alex.
Yes, thank you, Rachel. So as Rachel said, I help to oversee the Options Counseling Program, and I get to see firsthand some of the cases and examples that we have that come through for folks that are looking for our service. So I'll go ahead and present a few examples. Just know that these are anonymous examples. These are not real life examples. These are just a general what we can do. So you won't recognize anyone in these examples. So our first example is, go right ahead, Rachel. Our first example is Mrs. Apple. Mrs. Apple is in her mid-70s. She lives alone and until recently had very little health issues. She was independent, no issues, but unfortunately she did have a fall at home and it caused her to unfortunately break her arm and it limited her mobility. A neighbor noticed that she was just having some difficulties and they suggested, why don't you call South Shore Elder Services? They can help with some grocery shopping and laundry, cleaning, things of that nature. But Mrs. Apple just really wasn't ready to start those kinds of services, even with a limited mobility. So she decided to call us anyway, and she did speak with our intake specialist. And essentially, she let them know I'm not really interested in these services, but I am having some difficulties. And the intake specialist thought it would be best for her to speak with an options counselor. So just to see what her options were. She started her counseling session with the options counselor, and they started to discuss what programs and services would be available. And one thing they identified is that Mrs. Apple was having a very hard time with just the use of one arm, meal prepping and making and cooking her food, things like that. So they discussed starting some Meals on Wheels with her, and this was a service she was very open to. So she started receiving the Meals on Wheels. She receives 2 a day, and she's very friendly with her delivery driver. So they're on a first name basis. They have a quick chat at the door when he comes to drop it off. And she was very happy with that service. She didn't feel it was too invasive, but it did help with a major need that she really did need some help with. The options counselor did discuss some additional services like cleaning and laundry and things like that. And Mrs. Apple really continued to say, I'm just not comfortable having someone from an agency come in at this time. So knowing that she did need some help, the options counselors decided to take it from a little bit of a different perspective to see if there was anyone in her community or her family that could maybe help with these services. And the options counselor was able to help identify a few informal supports. So Mrs. Apple's oldest daughter, Elizabeth, was actually available to do grocery shopping. And Mrs. Apple did discuss this with her and she agreed. And then Mrs. Apple also has a nephew, Robert, who is also in agreement to help with cleaning around the house and doing laundry, maybe running some errands. And she felt very comfortable with this. Mrs. Apple, also through talking with the options counselors, decided to speak with her church pastor, who also offered some volunteers to help if she needed any yard work done or anything around the home. So she was able to identify some other supports rather than having to, kind of cross her boundary into an agency. So she was very happy about that, and her needs were being met, which is great. Mrs. Apple also discussed with the options counselor some additional community resources. They did talk about the Council on Aging, and she did start regularly participating in some of their programs, including a monthly movie night. She uses the transportation from the Council on Aging as well, just to get back and forth to the movie night, and some other just fun activities. And through the Council on Aging, she was able to actually find out that she was eligible for some funds to help pay for home repairs. So she did have a couple of repairs around the house that she just really wasn't able to afford at the moment, and was able to actually get funding to help do this. So really great all around. And just to summarize, really, so she worked with the options counselor for about 8 weeks. At the end, she was very grateful for the help from the options counselor and essentially reiterated, I really wouldn't have ever known about these services. And it would have been a little bit too much work for me to try and research all of this with my one good arm. So she was very happy at the end of this. So that is our case example for Mrs. Apple, our first example.
Alex, can I ask you a question before we
Oh,
move
please,
forward?
yes.
This is great.
Sure.
I like how you're able to take a scenario and really put together what an options counselor can do. This is wonderful. So if she didn't have a nephew or a daughter and she decided that she did need help with laundry and light housework, how much is that? And who goes into, who would go into her home to do this? Would that be covered under insurance, or is this something that's covered under the whole program?
So there's actually, essentially, I do go into it a little bit in the next example too,
Okay.
but for that kind of a service, we would make a referral to another department within our agency called the home care department. And through that department, folks can get services like the laundry and the cleaning. And what will happen is they start with an assessment. It will basically run through kind of their basic information, and it will essentially help to pinpoint whether or not they have a cost sharing, things like that. But it is a separate department at our agency that we are able to make a referral to.
Okay, thank you.
I just wanted to add one more thing in about the home delivered meal. The home delivered meal is a nutritious meal that is overseen by dietitians, but it also serves as a safety check. It's somebody coming to check every day on Mrs. Apple.
That is a great point, Karen. Thank you. Yes, the meals are actually very good. I've seen them and I think they're awesome. And it's nice because you don't have to do any prep with them. You can just heat them up. Very simple, especially in this situation. So very nice. And thank you. So we'll go on to our second example, which is Mr. Smith. Mr. Smith in his 60s, and he lives at home with his adult disabled daughter, Sally, and their small dog, Frankie. Unfortunately, Sally is unable to live independently, so she does live with Mr. Smith. And he was recently told that unfortunately his primary care alerted him he'll need to be having some surgery, and it will require an overnight stay in a hospital. So this was a bit stressful for Mr. Smith because it meant that unfortunately he would need to find care for Sally and Frankie as well. And unfortunately, they just don't really have informal supports in the area. So this was pretty concerning for him and causing some stress. Mr. Smith actually decided to contact South Shore Elder Services, and it really started for him because he would need help after his surgery as well. He wouldn't be able to do certain tasks around the house, so he had himself to plan for, his daughter, and of course, poor little Frankie. So when he came into the options counseling and he started speaking with the options counselor, they just really began the conversation. And just as Rachel said, it's really about the listening. We try not to talk too much. We want to hear what the person's goals are. The program is really centered around what do you need. So Mr. Smith identified that he'd be having surgery, and it was actually coming up very quickly. It'd be only within a few weeks. And he really needed some help. Really, he wasn't worried about himself so much as he was really worried about Sally. So the Options Counseling program was able to help identify a place where Sally could stay overnight, and she would be cared for, and that was fantastic. So it really started with that would be for the immediate surgery. So she would need somewhere to go overnight. And then they did identify with Mr. Smith that Sally could actually start attending an adult day health service as well. And the adult day health essentially provides some time for Sally to get out of the house. She can socialize with her peers, enjoy some activities, but it also gives Mr. Smith a break. He can do things that he needs to do during the day that maybe he otherwise just couldn't. And she really actually enjoyed the adult day health very much. It was something she enjoyed going to. The adult day health arranged the transportation to pick her up. So it was a fantastic service, and it continued even after the surgery, which is even better. And along the way, they also identified that Mr. Smith really didn't have a great plan going forward, that if anything were to happen to him, what would happen to Sally? So they also identified some additional resources to use if anything happened to if anything happened to Mr. Smith, where she would basically go and how she would be taken care of. So they were able to help identify that as well. And again, something not even really related to the surgery at the time, but just preparation for the future. As well as after that, just to prepare for the surgery, Mr. Smith let the options counselor know he didn't have a healthcare proxy or a power of attorney. He really didn't have those set up. So they were able to connect him to the local council on aging, who had an elder law attorney that was doing free sessions. So he was actually able to meet with the elder law attorney, and they were able to set up the power of attorney for him. And it was actually free again because it was through the council on aging. He also decided, as far as his own recovery went, he decided to also sign up for the Meals on Wheels. So he'd be getting meals delivered. And again, it's a check for him, which is really great. And the Council on Aging also started doing a food delivery for him, just for some staples, things like milk, bread, while he was recovering at home and couldn't really get to the store. We also set him up at South Shore Elder Services with the home care services, as we talked about. So Mr. Smith, we made a referral for him, and essentially he met with a case manager who completed an assessment and was able to determine if there were any out-of-pocket costs and what they would be. But he ended up ultimately being set up with someone to come in and take care of the house, do some cleaning, laundry, just doing his dishes, just things he couldn't do while he was recovering. And to kind of finish it all off, the best thing was that the options counselor actually found a place for Frankie to go as well while Mr. Smith was recovering. So everyone was okay. It wasn't a stressful event like Mr. Smith thought it was going to be. He didn't have to be worried. It was fantastic. And he did end up having the surgery. He recovered very successfully. And afterwards, he said, I actually ended up keeping some of these services. He continued with the home delivered meals for himself. Sally continued with the adult day health, and overall just made things a lot less stressful for him as a caregiver.
Wow. Alex, so for what seemed like for that gentleman to be a worrisome news from the primary care doctor, having to need surgery and thinking about who's going to care for his daughter and the dog, ended up having so many positive experiences and resources. So this is great.
Yes, and I think a lot of times folks do, it was news that was probably upsetting for him, but the most upsetting thing was that he had other folks he needed to care for, and their care kind of actually came first. And that's what he was most concerned about when he talked to options. So it's nice that it can come full circle for everyone.
Yeah.
And then we have our last options example, which is Jim. And this, we wanted to do just different examples to highlight that all sorts of folks come through the program and that it can kind of be for so many. So for Jim, he's in his 40s and he's actually disabled. It's following a car accident that happened in his early 20s that unfortunately left him with a pretty severe head injury. He does have difficulty remembering tasks and just remembering to do some care tasks for himself. He unfortunately can't drive either because of the injury, and he does need help going to the doctors, going to the grocery store, other things like that. Unfortunately, Jim is also on a very limited income because he cannot work due to this injury. And he finds that unfortunately, he often is a little bit low on money and it can lead to him needing some help with food. So the reason for the referral was actually that a neighbor called in to South Shore and identified that they are kind of actually the caregiver for Jim. They help him, take care of his home and do cleaning. They cook him meals. They take him to appointments. But the issue is that this neighbor has plans to move out of state within the next 3 months, which means Jim may be a little bit stranded. So the neighbor, really just wanting to make sure that Jim is okay when he does move, wanted to speak and get Jim set up with an options counselor. So Jim had a number of needs that he actually really needed some help with. He really needed help with managing his medical appointments, managing his medications, really help around the house, things like that. So he had Mass Health already, and he did have Medicare benefits because he was disabled. So the options counselor has discussed with him the One Care program through Commonwealth Care Alliance. And essentially what this program is it's an extension of his Mass Health benefits. And it's an insurance provider, but it really helps to provide Jim with all the services he would otherwise get through Mass Health and Medicare, and then provides him with additional services and a really nice case management team. So Jim was really able to benefit from this. He did enroll, he was eligible, all went well, he signed up, and he was able to start using their medical transportation. So he could go to his doctor's appointments, things like that. And he also they have some non-medical transportation, so he could go to the grocery store independently and things like that. CCA, the One Care program, also provides him with a homemaker to help around the house, and also someone to come in and just help with any hygiene needs, things like that, which is really fantastic. And since Jim had also identified that he was he had some issues with food, the options counselors did help to get him set up with SNAP benefits. So he was also eligible for that program. He was able to get enrolled and start receiving those benefits just to help alleviate a little bit of that stress with the food insecurity. And he was also able to get set up with some deliveries from local pantries as well. And he primarily used them around the holidays, which was really great. The biggest outcome from this, though, is that Jim was set up with the Brain Injury Association. And through the association, he was able to get additional case management. So he now has a case manager, Barbara, that can help. She can help sort through his mail, help him reapply when it's time for the SNAP benefits, and so much more. So he not only has some case management through Commonwealth Care Alliance, he's also getting it through the Brain Injury Association. And so Jim ended up working with the options counselors for about 3 months, right up until the neighbor was ready to move. And when they spoke with Jim at the end, he had, his neighbor had helped a lot with the calls, and they both felt that he was in a really good spot and that he'd actually be able to continue to live independently in the community, which is the most important thing. And it's a very big part of this program. We really like to help people remain in their community rather than, it's a goal of the program, rather than having to transition into a facility. So it was a win all around for Jim, for sure. So those are our 3 options examples. And then I also oversee the Family Caregiver Support Program at South Shore Elder Services. So I'll go into a little bit about this as well. So what is the Massachusetts Family Caregiver Support Program, otherwise known as MFCSP? So this program is really about the caregivers. So we were talking about options just a moment ago, and it, really helping out the individual, but there's not a lot of room in there for what about caregivers. So this program helps to get information, education, support, services to our caregivers, with the main focus being on them and trying to relieve as much of their stress as possible. So who is eligible? So there's a couple of groups that we have. So the first one is caregivers of older adults age 60 or over. And then also grandparents or relatives age 55 or over who are caring for children 18 years old or younger. And then we also have grandparents or relatives age 55 or older caring for a disabled relative age 19 to 59. And then lastly, we have caregivers of adults of any age with a diagnosis of Alzheimer's disease or a related diagnosis like dementia or Lewy body, et cetera, et cetera. So the program serves a number of folks, and the way that it works is that the family caregiver specialist will first start talking with the caregiver. And again, it is really about what does the caregiver need. We try to separate it out from what does your care recipient need, the person you're caring for, into really what is going to help make things easier for you. So we help to determine the caregiver's goals. And for example, some of those goals can be that I'm just really looking for support groups. I'm looking for help like this. But we discuss what their options are. And we really, especially now during COVID, like to focus on making sure that there is a backup plan in place. Especially a lot of these caregivers now are the primary caregiver and the only caregiver. And if something happens to them, their loved one could be in a very sticky situation. So we do focus a lot on making that backup plan and extra, folks to, if you are not available, to come in. And then we do help, and we continue with some follow-up and see what other services are needed. So some of the types of services that can happen or be referred by the family caregiver specialist is one-on-one counseling. The family caregiver specialist can provide that, in an in-home assessment, some in-home services recommendations. Respite is a big one. The family caregiver specialist can, depending on the ASAP, can actually sometimes offer a respite scholarship to the caregiver to help pay for some hours of respite. They can also make referrals to other sources of respite. That's a really big one that folks really like to utilize, because it's tough to get a break as a caregiver, and it's really needed. And that is what the respite service is. It's providing a paid break for the caregiver. Family caregiver also makes lots of referrals to our nutrition services. So like the Meals on Wheels, like we discussed, can help them get set up with transportation services, support groups, financial counseling, legal referrals. And then one I'd like to highlight is caregiver training, which it says here includes evidence-based. So at South Shore, we actually run a program that's called the Savvy Caregiver Training. It's typically about a 6-week program, and it helps caregivers that are working with dementia or Alzheimer's loved ones to get tips and resources and skills on how to work with their loved one. And it's really about reducing the stress on the caregiver and making caregiving a lot more smooth. And I know I'm almost out of time, so I will work to wrap it up. So the very last case that we have, and I'll go through this one quickly, is Mrs. Meringue. So she's a caregiver in her 50s, caregiving for both her mom and dad who are in their 80s, and they live with her. And she is also caregiving for her granddaughter, Julie. Mrs. Meringue is married, but unfortunately her husband is working 2 jobs and is really very limited. So Mrs. Meringue actually contacted South Shore Elder Services, and we connected her with Options Counseling just to help with some planning for her parents. But she did also go into the family caregiver program, and she just really reported she is, there's a lot of stress on her. She has a lot going on, being a grandparent, raising a grandchild, and having two parents in the home with dementia. So the family caregiver specialist really worked to get her some resources, which actually include respite for both of her parents, so that Mr. and Mrs. Moraine can both head down to Cape Cod and take a nice long weekend together, because they really need that. There was also a a camper scholarship for Julie, so she could attend a summer camp overnight, which is great, and it was paid for, which is also fantastic. Mrs. Moraine ended up taking the Savvy Caregiver training. It helped her immensely. And she was able to get connected with other support groups, and primarily one for grandparents raising grandchildren, where she was able to meet other grandparents that are also raising grandchildren at her granddaughter's school. So they were able to connect, they're able to support each other. It's fantastic. And she was in the program for about 4 months and overall felt so much less stressed and was able to really just be a better caregiver in the long run. So that is our family caregiver program, and it's a fantastic program.
So now we're just going to briefly talk a little bit about mass options. So you don't have to really know which agency you have to contact. As part of the ADRC, what we mentioned was mass options. So if you're just looking for help and you don't know where to start, you can call that number up top, the 1-800-243-4636. You can either call the number or you can go on their website, which is down below. And this is a new website that they just launched a little while ago. It has like a new fresh look. They're open Monday through Friday, 9 to 5. They also have easy referrals. So with the easy referral, you can go online and you can just enter your basic information and they can give you a call. But it's a call center, so they have call operators that are there that they will sit and they will talk to you, and they will get you to the correct agency where you have to go to get assistance that you're looking for. So they will get you to the correct company. And can you just advance the next slide? There we go. And right here, that's where it says call, online chat, get a referral, or questions.
So in closing, what we'd like to say is our job is to give people the tools they need to choose the right path for themselves. So I hope that's what we've communicated here today.
Well, you certainly, all of you have, and somebody just typed in the chat privately to me and shared that this is one of the best presentations we've had so far on this program. So I want to thank you all for being here. I know we're pressed for time, but I do have a question or two. As far as the caregiver program, do you find that is it more difficult to support the caregivers because perhaps out of them not knowing what their needs are, because they've been so busy taking care of their loved ones that they pretty much have dismissed their self-care, or maybe have suffered from compassion fatigue and whatnot? Do you find that it's harder to draw what they need for themselves?
Yes, for sure. And I think a lot of caregivers now more and more are in the sandwich generation. So just like Mrs. Moraine, they have parents that they're taking care of, a lot of times their own children. So they just it's so overwhelming. There's so many people to take care of and so many needs to worry about that caregivers unfortunately are at the very bottom of their own list, if they even make the list, unfortunately. So really part of that program is working to let caregivers know you actually need to be towards the top of the list, because if you're not well and if you're not healthy and taking care of yourself, everyone else that is relying on you also will suffer. So you do have to put yourself first, and as much as possible, and we help to give them the resources to do that.
And do you find, because of COVID and social distancing, many aging adults have become more deconditioned, suffered from loneliness? Do you find that there's going to be a greater need for your services in the next coming weeks and coming months as the world starts opening up?
I absolutely do.
Yes, definitely people are in need of the services, and people have been some of them have been reluctant to let people into the home, fearing getting COVID. So there's kind of a, people have neglected their needs sometimes over this period for a variety of reasons. So the best we can do is to keep the connection going and to provide whatever support we can and that people are able to accept.
Mhm. Does anybody on the meeting right now, any participants have any questions before we end the program? Nope. Okay. All right. So I want to thank you, Rachel, Karyn, Alex. I want to thank you for being on and sharing with us all the information that's going to benefit the aging population's lives. And everybody, if you have any questions about where to start, the number that they gave us, the 800-243-4636, the Mass Options number, seems like a good one to start with. And again, thank you all for being here. I look forward to seeing everybody again on April 27th, where I will have Megan Harrington, who is a physical therapist from Peak Physical Therapy. She'll be talking about Tai Chi and also falls prevention. So everybody, thank you so much. And I wish you all a really great day. Take care. Bye-bye.
Bye.
Thank you.
Bye.
Thank you.